Welcome everyone today, and thank you for joining us for the first in our COVID-19 and dementia webinar series, providing in-person services and supports to people living with dementia during COVID-19. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we start, Erin Long of the Administration for Community Living will provide a brief welcome. Erin?
Hi, everyone. I just want to thank you very much for taking the time out of your busy day to join us for this very important webinar. I want to thank our speakers, Victoria Jump and Jeffrey Klein, for their willingness to share their experiences in providing services during this most challenging time. And with that, I will throw it back to you, Sari.
Thank you so much. So as you heard, today's presenters are Victoria Jump and Jeff Klein. Victoria Jump is the director for the Ventura County Area Agency on Aging. She holds a master's degree in public administration and has been working with the County of Ventura for over 19 years. Ms. Jump is committed to assisting older adults and persons with disabilities in maintaining their independence. We also have with us today Jeff Klein, who's been an innovative visionary healthcare aging services executive and consultant through his almost 50-year career. He's currently president and CEO of Nevada Senior Services, operating adult daycare, in-home respite, home modifications, geriatric assessment clinic, and wellness programs, and is the Aging and Disability Resource Center for Southern Nevada. Welcome again to both of you and all our participants. I'll turn things over to Victoria Jump to get things started.
Hello, and thank you for that. So just to set the stage, Ventura County rests on the coast of California between Los Angeles and Santa Barbara counties. The county is a mix of urban, suburban, and rural areas with a total population of over 870,000 people, of which 204,000 are over the age of 60 and over 16,000 have a diagnosis of Alzheimer's disease or related dementia. So my presentation is going to focus really on our journey navigating COVID-19, how it's affected the populations that we serve, and how we've responded as an agency. I'll be drawing from some of the experiences Ventura County residents have had and how we've learned from the ever-changing landscape of what it means to serve older adults and people with disabilities. Next slide, please. So the COVID-19 crisis has proven to take its own toll on all of the United States, but especially on older adults and people with disabilities who have been identified as those at the highest risk from suffering from complications of or succumbing to the virus. Among the most challenging obstacles are limited access to social settings, minimized access to communication tools, isolation and depression, increased risk of cognitive decline, increased risk of falls or fatal injuries, decreased access to food and supplies, and the added risk of elder abuse. Next slide, please. So California has been hit particularly hard by the COVID-19 crisis in recent months. As of October 16th in my county, Ventura County, we've had a total of 13,597 cases of COVID-19 since the public health emergency was announced in March. There has been a total of 1,001 hospitalizations, 229 people ever in intensive care unit, and 160 deaths, most of these being older adults with comorbidities. So our COVID response as an agency, at a glance, has included an expansion of our senior nutrition program, community and restaurant partnerships, continuity of operations, community engagement, access to technology, Porch visits for our most vulnerable clients, and emergency preparedness support. Next slide, please. So what does COVID look like for many older adults and people with disabilities? It's safe to say that collectively we recognize the negative impact isolation, loneliness, and depression has on older adults and people with disabilities, especially during this crisis. According to the Administration for Community Living, 28% of older adults in the United States live alone. In my county, of the more than 204 100,000 people over the age of 60, 31,000 are living alone. The CDC recently recognized a 2020 study conducted by the National Academies of Science, Engineering, and Medicine that found the following. Social isolation significantly increased a person's risk of premature death from all causes, a risk that may rival those of smoking, obesity, and physical inactivity. Social isolation was associated with about a 50% increased risk of dementia. Poor social relationships characterized by social isolation or loneliness was associated with a 29% increased risk of heart disease and a 32% increased risk of stroke. Loneliness was associated with higher rates of depression, anxiety, and suicide. And loneliness among heart failure patients was associated with a nearly 4 times increased risk of death, a 68% increased risk of hospitalization, and a 57% increased risk of emergency department visits. Additionally, immigrant and LGBT plus populations are at a higher risk. Next slide, please. So what obstacles are people with cognitive diseases and their caregivers faced with in times of a crisis? Individuals living with Alzheimer's disease or another form of dementia have unique struggles when faced with a crisis. Because of this, their caregivers are also faced with a variety of obstacles. The Alzheimer's Association reports that more than 5 million Americans are living with Alzheimer's disease. Studies have found that people with Alzheimer's disease or another dementia-related condition struggle with changes in routine, are at a higher risk of suffering from isolation and depression, and have an increased risk of becoming chronically ill. The Alzheimer's Association also reports that 16 million Americans are currently providing unpaid care for a person living with a dementia-related disease. In times of crisis, caregivers can minimize disruptions to a routine. They can provide a sense of normalcy as much as possible. They can discuss the emergency situations calmly and in simple terms. They can be aware of changes in behavior or an increased agitation, as they may be signs of a more serious issue. And when feasible, we always ask that our caregivers seek respite to avoid burnout and exhaustion. Next slide, please. So we are fortunate in Ventura County in that we are a full service area agency on aging that provides a wide range of bilingual and bicultural services to older adults, people with disabilities, and caregivers, to include information and referral services, nutrition, housing, in-home services, transportation, long-term case management, health insurance, counseling, employment, and behavioral health case management. Additionally, we are an aging and disability resource center, a benefit enrollment center, and also a family caregiver center. We are also a current recipient of an ACL cooperative agreement aimed at increasing access to specialized services and supports for individuals with Alzheimer's disease and related disorders. Our focus is on those that live alone and that have an intellectual or a developmental disability. So our COVID response has been vast. We immediately identified the needs of older adults living in the area, those with disabilities, as those including those that have Alzheimer's disease or a related dementia. Among the most vital of those needs has been securing food resources and meal services. Our senior nutrition program dramatically transformed to include a full service pantry, a restaurant meal delivery program known in California as Great Plates Delivered, and partnerships with World Central Kitchen and 11 community meal sites. Since March, we have served more than 2.1 million meals to more than 25,000 unduplicated older adults and people with disabilities. Additionally, we have received more than 50,000 requests for services and have made more than 156,000 deliveries to people's homes, bringing meals or supplies. This has been made possible through countless county, community partnerships, volunteers, and donors. In addition to our meal program, we also have a garden that produces on average 1,500 pounds of fresh organic produce weekly during our summer months, all of which we put into our food boxes. So our garden is a year-round garden because of our climate, which yields approximately 20,000 plus pounds of produce per year. As a way to keep people engaged and feeling connected, we also started offering free nutrition counseling and educational courses via Zoom and by phone. Counseling and our classes are led by our team of registered dietitians. We also published a recipe booklet to include in all of our food boxes. The booklets were delivered to our case management clients as well. Next slide, please. So among the most vital elements of our response has been our continuity of operations and expansion of existing county and community partnerships, and the creation of new partnerships that we think will extend well beyond the current crisis. We've been able to quickly respond to the needs of the populations we serve, and we're committed to providing services for as long as they are needed. The work that we've done would not have been possible without this coordinated effort. And just to list some of the partnerships that we currently have is, so we utilize the County of Ventura's Disaster Service Worker Program, which takes county workers that are in other departments that are not needed during the crisis and brings them over to us, and then we can use them. And so we brought an additional 63 new members to our team on a temporary basis. We have 11 community meal sites. And these partnerships were established prior to COVID-19, but they've remained critical in reaching as many residents as possible. We've also developed partnerships with 34 locally owned restaurants and catering companies that are a part of our restaurant meal program known as Great Plates Delivered. Go Access is our local dial-a-ride provider. When the crisis hit in California, people were canceling medical appointments and trips to the store and places that our dial-a-ride provider traditionally went. And so because they didn't have the business, they turned to us and asked us, what can we do to help you? And so they've made thousands of deliveries for us. And we also formed a partnership with World Central Kitchen. The community has also been tremendous with their support. And we really looked for, companies that are local to our county to see, how they could help us. And one of the first was to step up was Procter & Gamble, who donated toilet paper, paper towels, laundry detergent. We partnered with our local food pantry, who passed on all of their donations of adult diapers onto us. We partnered with a company called Direct Relief, which is an international direct aid company who provided us with things like toothpaste, shampoo, soap, razor, that kind of thing. Dole, Seas Candy, the Church of Jesus Christ of Latter-day Saints, two produce providers in our area named Limonera and Calavo also provided generous donations, regular donations of fruit and vegetables as well. Additionally, we had countless donations from private citizens just wanting to know how they could help. And that included cash, offers of stock, and people with fruit trees in their backyards that have said, I have 4 fruit trees. If you can come and pick them, you can have all the fruit. We sent people to do that. Next slide, please. So our communication efforts with the community have increased a great deal over the last 7 months. We have focused on ensuring that the community has access to resources in multiple language and that our information is provided both online and in hard copy format. Case managers and staff have also been regularly communicating this information with our clients. Some of the methods of communication that we've used included information on how to access meal services and other resources, how to register for our classes, letting the community know about the grocery store hours that have been reserved for older adults and people with disabilities, letting the community know how important it is to stay connected to loved ones and their neighbors who might be especially vulnerable. And we do regular press conferences with the county where we repeat the same message over and over again, how the community can stay connected, how you can get to know your neighbor and help them. We've also communicated how to connect with our people in the community that are experiencing isolation and depression through our Letters of Support campaign. And we've also had a series of a video series showcasing our response and how to access services as well. So in September, we launched a Letters of Support campaign in partnership with Meals on Wheels America. This campaign is designed to provide older adults and people with disabilities in our county with letters or cards and a message of encouragement and support. With the holiday season quickly approaching, we know that really this is one of the most critical times to extend not only our services to these populations, but also care and support as well. So letters are mailed or dropped off at our office, and we have a team that reviews the letters to make sure that they're appropriate. And then they are put into the food boxes. To date, we've received a couple thousand letters from the community that range anywhere from people that are currently in jail. They're sending letters of support to, Girl Scout troops, and elementary schools are also helping. So in addition to the communication tools that we're using that I've mentioned, we're also working to launch an additional program designed to provide older adult and people with disabilities who don't have access to technology with a device that will be a tablet or a laptop that can be used to connect to medical providers, family members and friends, community services, and also programming. Next slide, please. So our team of case managers have been conducting porch visits to assess the overall well-being of some of our most vulnerable clients, including those who have life-sustaining medical equipment and those living with Alzheimer's disease or related dementia. So porch visits, we found, really provide a safe environment that includes the use of the social worker wearing a face mask and face shield, gloves, and using sanitizer as well. Porch visits allow our social workers to provide in-person interactions for clients who are especially vulnerable to isolation and depression, to better identify the physical and emotional needs of clients, and provide companionship through an in-person connection, and also address methods of increasing physical and cognitive activity. Prior to us going out with porch visits, there was a period of time for a couple months where we weren't allowed to go to people's homes, to go inside people's homes. And we did notice that there was a desperation to those calls, and people were, so lonely for companionship. But also we found that a lot of times that if you're not seeing the environment, when you ask them how they're doing and how their condition, what it's like, they're telling you what they think that you want to hear, not necessarily what's actually going on. And so we have found that, it's been instrumental for us. Next slide, please. So this is one of our porch visit client testimonials. So we have received dozens of positive responses and letters from older adults and people with disabilities related to our porch visits. So this is one of the recent ones we received from a client who worked with one of our social workers, which you can see her, Annalette. So the testimonial, the client said, it was a very fortunate thing for me that I was part of a 12-visit program with Annalette. Anna was very nice, supportive, and never judgmental. Her visits brightened my week. It was very sad for me to say goodbye. Those 12 visits went really quickly. These times with the pandemic has made socializing very difficult, if not impossible. I'm relatively young, 72, and I enjoyed Anna's visits and being able to sit outside and talk with her. It doesn't take too much imagination to know how much the end of her visits would impact people in a more serious condition. Senior lives matter too. Please talk with the powers that be and remind them that social contact can increase quality of life for seniors. Maybe the program visits could be increased, especially during the holidays. I appreciate being part of this program, and I appreciate Annalette. Thank you for listening. So we do recognize how critical these in-person connections are for our most vulnerable clients. For many, this is the only source of companionship they have. Next slide. So Alzheimer's disease accounts for 60 to 80% of dementia cases and currently impacts an estimated 610 Californians, a number expected to grow to 840,000 by 2025. To help educate the public about having understanding, tolerance, and patience, and to advocate for the growing number of older adults with this disease, we have launched Dementia Friendly Ventura County and continue to leverage community partnerships to provide services for this vulnerable population. Our goals are really to create a county where persons with dementia and Alzheimer's disease are valued, respected, feel safe, and caregivers are supported, to educate and inform all entities that serve the public about the unique needs of this population, to better serve and support them, to promote community awareness of the condition and how individuals and businesses can make a positive difference. Some of the resources that we offer, we provide dementia-specific customer service training for our local businesses, educational materials for businesses and the public. We have an online directory of dementia-friendly businesses. We provide caregiver support and memory cafes. And during the COVID crisis, we have made an intentional effort to make sure that all of these initiatives do continue and that we're not stopping them. The only one that's temporarily paused is our memory cafe. Next slide, please. So there are a variety of resources in every community and in Ventura County as well. So these are some of the resources that we commonly use, and I'll just highlight a couple of them. So the first one is vcemergency.com, is our county emergency services website. So if there's a fire, a flood, anything going on, that's where the Office of Emergency Services posts everything to the community to know. So we made sure early on to connect with them and have them provide a link to our website. And we had them create a food page as well. So if you were hungry and needing services, we made sure that there was a link provided to us so people could find us. 211, we connected with them early on and provide them with a lot of information of what our services were going to look like during COVID-19, and also how to connect their callers with our services as well. Our website is listed, which is VCAAA.org, which houses an online PDF of Live Well, which you can see there on your right-hand side, which is our bilingual resource guide specifically designed for the populations that we serve. And we're also very connected with the disability community as well, and we rely on them. So we do remain committed as an agency to ensure that people remain safe during really any disaster that we face. So we understand that the methods of meeting those needs effectively are always going to continue to change, but we also make sure that we're ready to meet those challenges head on. Next slide. I want to thank you for your time today. I've provided my contact information for those that are of you or that are interested in reaching out for more information. I also encourage you to visit our website and follow us on social media. Thank you.
Thanks so much, Victoria. Jeff, we can go right to your presentation.
Well, greetings, everybody. We're going to try to drill down a little bit right into the experience for adult daycare slide. Next slide, please. There we go. We'll take a look at where we've had points of action in order to continue to provide adult daycare services during the pandemic, and particularly recognizing that within the Southern Nevada community in particular, we're the only not-for-profit provider and the only major provider in terms of dementia-specific services in the adult daycare population. Not that some of the other adult daycare centers don't provide services to people who may have a cognitive impairment, but because of the nature of reimbursement in Nevada and the fact that we're dealing mostly in a for-profit environment, anyone with any significant impairment is going to probably end up coming to us. Next slide, please. So one of the things that COVID-19 really enforced was having a clear sense of where one needs to go. And that's become very problematic in terms of making choices over how one addresses the pandemic, how it impacts our dementia population. So thoughts constantly are being surfaced and evaluated from our family caregivers, from our clients, and from our community about their priorities, their challenges. So we really want to encourage everyone who's struggling through these moments together that having a firm grip on what you want to achieve and where you are in your environment is critical to knowing which direction to go. Next slide, please. So it's important to know what success looks like. And that's really difficult in the adult daycare environment because all the rules are gone. We now have people that we're servicing remotely from home. We have people who have been with us all along, and we have people who are returning to us with significant impact on their cognitive impairment as a result of their social isolation. So people come back damaged, not the same people that left us in March or April when they made a determination to stay home because of the pandemic. And focusing on how one deals with these different environmental factors and operational factors is really important. And if you want to keep your staff from going off the deep end constantly, it's important to help keep them focused, which means they need to know what victory looks like. What does success look like during the day, during the week, during the month, and as an agency? Next slide. So Nevada Senior Services, we operate 2 adult day healthcare centers. One's licensed for 80, one for 70. An in-home respite program, home modifications, geriatric clinical assessment program. We have a whole range of evidence-based programs, wellness initiatives. Our Care Partner Institute, which utilizes primarily evidence-based and evidence-informed tools to assist family caregivers, and we are the Aging and Disability Resource Center for most of Southern Nevada. One item not on this slide, but worthy of mention is Hospital Home, which is an initiative that was developed with ACL funding to create a dementia-friendly approach to helping people with a cognitive impairment address that while in the hospital and then successfully transition back to their homes. And we're very proud of that program. Just to give you an idea, the readmission rate in Southern Nevada for Medicare is 35%. Our Hospital to Home program has a readmission rate of 0. We've yet to have one return to the hospital with the same diagnosis. Next slide. So these are what our centers look like. The one on the right, the Adult Daycare of Las Vegas, was built in '94, has a lot of challenges because its physical plant is older. It's an urban setting, and we have really had to scramble in order to make that space work in the COVID-19 era. And our Henderson facility, which is now about 7 years old, on much more land, somewhat more spacious, and a design that actually works much better for COVID-19. And we'll talk about a couple of those design elements as we go. Next slide, please. So in addressing the whole COVID-19 issue, it became very obvious to us early that we needed to know where we needed to take an action, where we needed to focus on changing our organizational environment and operational environment. So first and foremost, we charged into revising our policies and procedures, and we have taken what has been a very difficult emotionally and organizationally position that we do not make exceptions to our policies, our procedures, and our best practices. So we screen everyone every day, staff, participants who come through the door, and on those rare occasions when a transport person or someone else needs to breach the outer wall of our facility and come in, we screen them too. And that includes a questionnaire and vitals and some rigorous questioning. We've taken a position that there are no outside visitors or guests to the facility. And then we've also taken a hard position on staffing issues. So we do not permit staff members to travel outside of Nevada and continue their work schedule when they return. They have to quarantine for 14 days and have 2 negative COVID tests in order to return to work. And the same thing is true if they have local contacts. So if somebody comes to visit from out of state, stays with them, or someone that they have had in their family or friendship circle who's had an exposure, same rules apply. 14 days quarantine, 2 negative COVID tests that would show no shedding. And then we have taken our already rigorous infections control procedures and adapted them to be even more rigorous in terms of COVID-19. Next slide, please. So as I mentioned, physical plant has really been a challenge. Control of the physical plant. So we have used plexiglass to create barriers and wall-off spaces while still trying to keep the sense of openness. A absolute, almost over-the-top approach to safety while maintaining a positive attitude. Environmental maintenance, as I mentioned, we try to control every access point to our buildings. Rigorous cleaning both during the day and then deep cleaning every night. Distancing, so we have removed furniture that would allow for congregating closer than what we think is a reasonable distance in that environment. And as I mentioned, friendly barriers, plexiglass. Next slide. And you can see in this slide, just next couple of slides, a little bit of some of the little things. This is actually a fairly large multi-purpose room. You can see it was set up for pizza. We've tried to make it creative and welcoming. This environment changes almost every day. And you can see the distancing going on, and 2 of our clients in here wearing either shields or masks. Next slide, please. One of the things that we've learned is to make our environment our friend. And while we've always had an approach to integrating the outdoors, while the weather supports it, we have really gone all in on getting people out. So you can see this is one of our patio areas with flowers, but even there we have encouraged, as you can see, these are 2 of our clients, even in the outdoor spaces, wearing masks has become the activity du jour. And some of our masks, by the way, have been made here as part of our arts and crafts programs, and the clients love their own masks when they get a chance to make them. The only problem is they want to take them home. So we're constantly replenishing them, the stockpile for the clients. Needless to say, with our dementia clients, next slide, one of the issues is having clients maintain wearing the mask during the day. And some have issues about keeping them on. Other clients have an issue of taking them off, and really struggle with, gee, you need to take it off to eat, or you need to take it off for this purpose, or by the way, you need to leave it with us so that we can sanitize them overnight. Training is everything. So we train, we retrain constantly, and our model is train them, coach them during the day, retrain them, build their competencies, build their confidence in their competencies, then reinforce, and then use our floor leaders to inspire the staff. There is no wiggle room in any of our procedures for staff members to let down, so it really needs to all become automatic for them. Everything we do to work with our dementia clients to ensure they're being redirected and not getting into trouble either with each other or with the environment, working with staff to help each other, to team with our clients, to make sure we're always following our infection control procedures, that we're maintaining the positive attitude that we need to maintain, all in what's become a very alien environment. Next step, please. Next slide, please. So our staff training always works from the premise that there are both challenges and changes always ahead. And so we're always adjusting our approach. We keep COVID-19 on the forefront constantly. We train our people on policies, procedures, infection control. We update behavior management based on what we're learning about, particularly some of our returning clients. We're always addressing the why question with our clients and our staff. Client communication is always at a premium in adult day healthcare, but even more so in this environment. And caregiver communication is critical, and the staff plays an enormous role in communicating with our family caregiving and maintaining the joy during the daytime while the clients are with us is the most important thing we can do for them, but also for our staff, and making sure everybody is comfortable with rolling with change. And that change process is a constant flow like the ocean tides. Next slide, please. So one of the issues that also stays with us is how we address very difficult issues of staffing while our census is a fraction of what we started with. So just to give you an example, our Jones facility, as I mentioned, was licensed for 80. In March, when COVID hit, that 80 went to about 12. And we did not lay off one client. We remained open. We did not lay off one staff member. And as census started to roller coaster up with growing, people returning, some new clients coming to us, and then a spike in the community and everybody panicking and the numbers going down, and then reopening and numbers started to come back up. While all that was going on, we recognized the importance of maintaining our very knowledgeable, trained staff, and also that in this environment, that higher numbers of staff are really necessary in order to deal with the issues the clients have during the day. So we are still staffed as if we were for 80, despite the fact that our census right now is in the 40s at Jones, as an example. I mentioned that we monitor health and exposures for our staff as vigorously as we do for our clients and our family caregivers, and it's really important. And I know it has been a cause of considerable pain for staff members to be told they have to stay home when they hear that if they were only working at a restaurant or a casino or some other property, that they might be able to work under the circumstances of the level of exposure they've had. But we have really taken a very, very rigorous approach, almost ruthless in our enforcement of our rules. We make sure we communicate changes in all our procedures. We explain why, we reinforce, we train, and then we, as I mentioned in the previous slide, we retrain. We involve staff in the decision making so they understand how important some of these issues are. We have daily huddles throughout the day where we'll pull some staff members together to address a client concern or a family concern or a staffing concern. So quick huddles are the rule. We celebrate often. So I mentioned about the importance of maintaining the joy. Celebration is really important. So client does something wonderful, we celebrate. Staff member does something wonderful, we celebrate. We look for reasons to say thank you and to be joyous. And that saying thank you often is like smiling often. You just can't help when you say thank you, but to smile, and that smile brightens up our building. Next slide, please. Maintaining morale, as I've implied, is fundamental to our success. We've got the normal stressors on family caregivers and participants. It's all been amplified by the COVID. People are brittle. And our special populations, people with chronic diseases, our IDD folks with cognitive impairments, all create special challenges that really engage with the staff, and the importance of maintaining everybody's morale is paramount. So as I mentioned over and over and over again, and you'll hear it a few more times yet, find the happy places and celebrate. Reinforce your supports, both on site for clients who come to us and those virtual, and we'll talk about virtual in a moment, and create opportunities for decompression. So we offer a meditation program during the week for our staff to make sure that they're dealing with their pressures, they're dealing with their stressors, they're not overloaded as best we can. We provide our mental health team provides counseling to staff members as well as to family caregivers. And we have a very active program of peer supports. Next slide, please. So to do all of that, we have really tried hard to lift the spirits. So this is one of our staff members. You can see, again, clients wearing masks. You see the chairs stacked up in the back. We removed a ton of chairs from this activity room at our Henderson facility. Kaylee is an amazing staff member, one of our aides. She does regular entertainment, and clients love it. They get some energy, and Kaylee Live has become a joy for both the staff and our family participants and our clients who are in the facility. Next slide, please. We try to make sure that our exercise program is always with us throughout the day, and you see on the left Dee Dee Woodbury, who is just an amazing activities director. I always say that when she's in the building, you can tell from the outside because there's a big bright light around the outside of the building, and she's leading a conga line here of masked and gloved staff and clients. And on the right, you see one of our clients with his Hawaiian lei and his mask and his walker. Next slide, please. So you cannot over-communicate. And folks are sick and tired of hearing me throughout the day reminding our staff to communicate to our family caregivers, which we do by sending things home, by calling them on the phone, by doing flyers and newsletters, our participants, staff, and we are out in the community all the time, blasting it out, sending it home with paper, posting it on our website, putting out press releases, public announcements, and local media about everything we do. We've probably had more local news people to our centers about a range of issues, whether it's adult daycare or nutrition or safety or procedures for keeping people safe, but there's a constant connection to local media to keep the community engaged with us and to feel comfortable with the level of services that we're trying to provide by adjusting to COVID. Next slide, please. So one of the things we've done that we're very proud of, and we've actually started to share it outside Southern Nevada. We've just done one in another part of for another part of the country and getting ready to do one in the Midwest, is called Chasing Away the Corona Blues, which is a joyful a 1-hour wellness seminar that we've adapted for different populations. We've co-partnered with AARP Nevada, with the Alzheimer's Association, and it's a virtual program which brings a level of joy and mood adjustment to people while they are locked up in their homes and emotionally dealing with the virus. It's been incredibly successful, and we'd be happy to share it and arrange to do it for others around the country. Next slide, please. So virtual is a major piece of what we've done on the adult daycare side. So while the census dropped, we still had to support our folks at home. And so we created a virtual environment, heavily Zoom, but not exclusively. We do weekly themed groups. We have popcorn poetry. We ship food home, and including things that they can use in their Zoom escapades with us. We have call and response poetry on Zoom, reminiscing, an idioms group. We do inspirational good news sharing, brain games. We ship home recipes for making organic clay in the home, and then using that clay in an activity that one of our activities people leads folks through as a program. We do breathing exercises, visualization, morning wake-up routines, our doggy talk, which is a pet-themed meeting, sharing and connecting around the world, and you saw a little piece of that with the pizza program, American Sign Language, and we celebrate every holiday we can find. As I mentioned, we try to maintain a joyful environment, and celebration is really key. Next slide. So finally, what have we learned? So over-communications is non-existent. You cannot over-communicate with both the staff and the family caregivers and with our community. We use our website aggressively. We have a coronavirus page. Coronavirus is highlighted in my opening to the website on the front page. Next slide, please. We try to keep an environment that's constantly in positive motion, so we are always reassessing, always reevaluating, and always reimagining what we do. It's important to keep calm and deliver the outcomes. As I said, you have to define success. You have to be fearless about it. This is not the time to be timid about an action. Take it, engage, do it joyfully, evaluate it, and then if it doesn't work, rethink it. And be absolutely ruthless in your resolve. Don't falter. This is no time either for your staff or your community or your clients or your family caregivers to think that you don't have it together. Next slide. So finally, we believe that in the COVID-19 universe, particularly for our dementia population, coordination is the key, maintaining our person-centered approach, not forgetting that these are a family response, both the families in our homes, our family caregivers and clients, Nevada Senior Services as a family, and that we should never stop promoting the notion of connectedness and well-being throughout. And then lastly, and I've tried to start closing everything I say with this, it's important to express gratitude. And so we here express gratitude to the Nevada Senior Services team, who are my heroes, but also to our family caregivers who loan us the people they love to take care of during the day and loan us their time if they're in their home to hopefully brighten their day. Next slide, please. The idea of a coordinated, person-centered family response, we've kind of touched on all these issues, so slides there is kind of a menu for your reference. Next slide. And my last two words for you are, don't be afraid to think out of the box. This has really forced us to really be aggressive about our willingness to embrace new ideas constantly. And lastly, I believe Sari has posted in the chat a link for connecting to a site we've set up where we are posting some of our best practices, policies, and procedures, so that if you have an interest in the nitty-gritty of how we do it, you can download that. And we will periodically update it if you want to go back to it. So with that, hopefully I've left enough time for you to have some questions for Victoria or for myself. Thank you.
Great, thank you so much. We are going to go to questions now. And I thank Victoria and Jeff for their excellent presentations. There have been a few questions that came in about the PowerPoint slides. We will be able to send those to participants. So sit tight and we'll get those to you soon. And the first questions that came in, Victoria, I'll direct this one toward you. It's specifically about Ventura County and how you determined the most pressing needs of seniors in your county during COVID-19.
Sure, this is a great question. So since we are an ADRC and we have a call center, every call request for assistance, we have a contact marker that tells us what type of service that people are looking for. And so we knew, early on that like 90% of the early calls were related to food and lack of access to food. So we knew that we had to pivot in that way.
Great, thank you. And let's see, the next question goes to you, Jeff. Can you talk a little bit about the vitals that you're taking when you're screening your adult day clients? Do you take more than their temperature? Can you go through that a little bit?
Yeah, we do a complete set of vitals actually. So we are taking oxygenation, blood pressure, and temps, as well as looking at their eyes, watching their breathing, ensuring that there are no early signs of anything. And then if we spot anything, then they are quickly whisked off to the secure nurses station where we'll do a little more in-depth check if we have any concerns whatsoever, and then respond appropriately.
Great, thank you. The next question goes to both of you. Can you talk a little bit about what the most effective ways have been to motivate and inspire staff who may be concerned about contracting COVID-19? Victoria or Jeff, do you want to start with that?
Sure, I can start. This is one of those difficult things. As we were, considered a mandatory service provider because of what we do, it wasn't a choice for staff not to show up. And so as an employer, we really had to make sure that employees felt safe coming to work. And so we did all of the temperature screening, which we do because we're, preparing and serving food as well. There's, the gloves and an extra set of precautions to take. I think really, one of Jeff's, last slides talked about like the whole gratitude. And I think, just repeatedly expressing that to staff, that what they're doing makes a difference, showing them the letters and letting them hear the voicemails that coming in from such grateful, people in the community has really inspired them and kept them going at times when they were, fearful of coming to work. When we started the Porch visits, it wasn't the most popular decision with staff. Many of them are like, it's not safe, I can't go there. But we put them in a situation where they were safe. So we protected them, we protected their families, we set up, the policies and procedures to really protect the clients. And once they went out there and they understood the value of what they were doing, they like totally got it.
Great,
I would totally agree with what Victoria had to say. And the only thing I would add is to remember that your staff live in the community. They go on the internet. They hear reports on the radio, they see reports on TV. Not all the information is good information. Not all the information is applicable to our environments. And frequently, some of the things that get reported which impact restaurants or schools or some other environment really are not relevant to us. So it's important for the staff to have good information, to know it's well-grounded in whether it's the CDC or our local Southern Nevada Health District or our state health department, and so that they can feel safe. We lost 4 or 5 nurses in the beginning of this, half of whom came back to us a week or two later once they started feeling more comfortable about the environment that we're in. So joy, thank you, safety, and constantly reinforcing good information so that they know that what they're hearing in the community that might panic them may not be something that they need to be embracing in terms of their work with us.
I would also add to that, the other thing that we've found that really has helped as well is to really being open to suggestions from staff. Like this time more than any, we've asked them, this is what we're trying to do. Do you have any ideas? And some of our best ideas have come from staff. And so they feel like they're part of it and they're helping make the decisions as well. And it makes them feel safer and valued.
Great, thank you. So can both of you talk a little bit about any training you gave to clients or caregivers to ensure that they understood how to use devices when conducting virtual sessions and virtual communication with them? Did you, if you Victoria, when you use tablets or devices, how did you set those up and help folks learn how to use them?
So we're in the process of setting up all of the devices. So we're in the purchasing process. But for our regular visits, in-person visits, really it's setting the stage before we ever go to the home. And that includes, a social worker or includes bringing a meal to the home where the client understands what the expectation is and how we are working to keep them safe. And so they're given a set of, rules, including we're not going into your home, which is, one of the hardest things because they're desperate. This is the first person they've had for a while visiting and they want to invite the person in and we can't put them at risk in going in the house. So we're not requiring clients that are, they haven't left their home necessarily to start masking up, but they are expected, our staff they understand for us visiting there that we're going to come in full protective equipment, and they also understand that there has to be a physical barrier between us and them. And so we tell them in advance how far away you have to stand from our social worker. If we give you paperwork, we're not handing it to you. This is the way that you're going to get it. So we manage their expectations, going into the visit.
Great, thank you. Jeff, do you have any comments on this question before we close out today's session?
We have a team of folks, mostly the folks who also do the presenting. So one of the things we've tried to do is make the contacts with the families, the people they've gotten to know in working with us over time. We think trust is really important. So our IT department has really done an outstanding job educating our social workers and our nurses and our activities people to really get comfortable with the technology that we use so that then we can prep our family caregivers and our clients with somebody that they know who can walk them through their concerns and make them feel comfortable that they're not stupid because they don't know how to use it or that they're having difficulty. These are folks they know, so they're comfortable with them. And then we will walk them through the technologies. We've learn to do most of it virtually on phone calls and coaching them through the way you would with a call into one of the tech centers. But we've also sent people to the home, and again, when we do that, it's people they know, and we'll help set them up. We'll help lock in our IT person if we have a difficult problem who can coach them.
Great, thank you so much. Well, we are about out of time for today. I want to thank you both, Victoria and Jeff, for your great presentations and imparting some knowledge for our participants that joined us today. I do want to mention that we have a few webinars coming up, another one this week from our general NADRC webinar series on October 22nd on sustaining programs for people living with dementia and their caregivers. Billing for dementia services and how that process works. Registration information is on the American Society on Aging website. We also will host the second in our COVID-19 and dementia webinar series on November 2nd, which is entitled Using Technology to Provide Services for People Living with Dementia and Their Caregivers during COVID-19. So we hope you're able to join us for those additional sessions, and thank you everyone for tuning in today. We hope you have a great afternoon.